even tougher action in some areas, and that does affect schools, and let me set out for you what this means. In most of England, primary schools will still reassemble next week as planned for the new term. But in the areas we've just published today on gov.uk, I'm afraid the start of the new term will be delayed until at least January the 18th, when the latest data on those infection rates will be reviewed. And that is because the rate of transmission in these areas is so high, and there's just such pressure on the local NHS that extra action is required to control the spread of the virus. The children of key workers or those who are considered to be vulnerable will still go back to primary schools from next week, wherever they live in England, and they are not affected by today's announcement. In secondary schools, all vulnerable children and the children of critical workers will go back next week across England as originally planned. But we will ask exam year pupils in secondary schools to learn remotely during the first week of term and return to the classroom from 11th of January. The remaining secondary school pupils, i.e. non-exam groups, will go back a week later. That is from the 18th of January. But I want to stress that depending on the spread of the disease, it may be necessary to take further action in their cases as well, in, as I say, the worst affected areas. To minimize disruption in schools and to fight the disease, we're massively expanding our testing operation, ensuring that every secondary school pupil is tested as they return and regularly thereafter. I, again, want to thank teachers, pupils, parents who've worked so hard to keep schools safe and keep them open. We're also asking universities to reduce the number of students who return to campus in January, prioritising medical courses and others requiring face-to-face teaching. And in all cases, students should be offered 2 rapid tests when they return. All of these measures are in the end designed to save lives and to protect the NHS. And for that very reason, I must ask you to follow the rules where you live tomorrow night and see in the new year safely at home. That means not meeting up with friends or family indoors unless they're in the same household or support bubble, and avoiding large gatherings of any kind. We are still in the tunnel of this pandemic. The light, however, is not merely visible. Thanks to an extraordinary feat of British engineering, if you like, the tunnel has been shortened, or we're moving faster through it. And that gives me great confidence about the future in the spring.
Hello.
So, for now, let's redouble our efforts.
Hello
let's
po,
follow
Mr.
the
Romeo
rules,
Bautista.
protect our NHS, and together make 2021 a year in which we leave this tunnel behind us. I'm now going to hand over to Jonson Van Tam to go through the slides.
Thank you, Prime Minister. I'm going to now deliver the data briefing to you. And I would first of all say that always remember, please, that infections happen and then they are reflected in the statistics several days later when people come forwards for testing. They're always out of date by a few days, in other words. On top of that, Christmas is always a difficult time to assemble stable statistics. So please bear both of those points in mind. First slide, please. You can see here 2 pictures of the UK, one based on the 10th of December and one based on the 24th of December. And you can see that the average case rate per 100,000 through testing is 190 per 100,000 on the left, rising to 380 per 100,000 as a UK average by Christmas Eve. The heat maps on the geographic representation,
Madali po kasing
the darkest
makahawa yung
areas are the
virus na
hottest
bago.
areas,
Kaya
and you
ano,
can see overall there's been a considerable growth
okay naman po kami
across the national
dito. Dito lang
footprint
kami
in
sa
that time,
bahay.
and particularly
Shout
centred
out
on
kay
London, the southeast, and
Clark
the home
Justin de la
counties, and
Peña.
also
Shout out
South
sa'yo.
Wales.
Happy New Year.
Next slide, please. This is now being reflected in the number of people going into hospital with COVID-19 across the UK. On the extreme left, you can see Scotland, Northern Ireland and Wales, and then you can see the English regions on the right of the slide. And I really want to draw your eye to the three in the bottom right-hand corner, the southeast, London and the east of England, where
Hi
you can
sa'yo,
see very sharp
Romeo
rises
Bautista.
that have
Hello.
really taken off since early December, but particularly so in London in the last few days.
Hello
With
sis, the
regard
men
to the
world. Hello
Midlands, the
po.
Northwest and Northeast Yorkshire,
Ganito po ang
you
ano
can
dito
see
sa
that
London ngayon.
things are
Ang
not running quite
sitwasyon,
as
ayan
hot
po,
as they were
nagsasalita yung ano ni
in early
Boris.
November. They've come down a bit, but they have
Madami
not
pong
really,
nagagalit sa
they've
kanya. Ayan po,
stabilised at a high rate. They
angry.
have not dropped low. So
Ayan po, nagahaha
that's
siya.
equally a
Sila.
problem that we face now. Next slide, please.
Sobrang dami ng
Data from the
cases po
Office for
dito.
National Statistics show you here
Kamusta
from
po,
the surveys the
ate? The
estimated
men
number
world,
of
shout out po
people
sa inyo.
testing positive in England over time. From typically at the start of the autumn, 1 in 900 people testing
Dahil po
positive,
sobrang lamig
to a
ngayon
point
dito,
just
buhay na
before
buhay yung
Christmas,
virus.
where nationally in England, 1 in 70 people were testing
The
positive.
same here,
And you can
madam.
see the
Madami
effect of the
rin.
national
Oo
restrictions,
nga po
bringing the curve
Sobrang dami po
down
dito.
in the period between 6th November and 5th December. But then, unfortunately, you can see the sharp takeoff after that. That is all too familiar to all of us now. A little word on this slide on the new variant
Basta
coronavirus,
madaming
which has
pasaway,
been reported
mag-i-spread talaga ang
widely in the
virus.
media.
Opo. Marami pong pasaway kasi
Testing that
dito.
is compatible
Hindi mga
with
nagmamas.
identification of the new variant are the dark blue lines, and the other variants, or the old or the pre-existing variants, if you like, are the brown lines. And what you can see is in that bottom right-hand corner again,
Ayan po,
where I
dami.
drew your attention to those very sharp rises in hospital admissions,
Ay. Namatay.
percentage testing positive for the virus, the percentage testing positive with the new variant is increasing
So,
at
sobrang dami
really
po
a
ng
very
ano,
substantial rate
ng
indeed.
cases dito.
In
Dumadami.
the other areas, or most of the
Year po, sa bahay lang yung mga tao, bawal magbisita.
with not much more than the eye of faith,
Laging ang
you can
kanilang
see
sinasabi ay
those
nawawalan sila
upticks
ng
of the new
freedom.
variant beginning
Yun
to
nga
occur.
po.
And that obviously is of enormous
Kailangan po,
concern
di po ba,
that the new
kailangan
variant,
po
with its
maging ano
increased
tayo,
transmissibility,
maging maingat na lang po.
is
Saan po
beginning to
kayo
spread to
ate?
other
The men
areas
world?
of the UK.
Canada po ba kayo te?
Final slide, please.
Lagi ang kanilang sinasabi,
This slide
nawawalan
really
sila ng
geographically
freedom.
summarizes
Dito po may mga
where
disiplina
we are
naman
in
din po
terms
yung
of
ano
the
te,
tier
yung mga tao
restrictions
dito.
being announced today. A very
Pagka po
large
sinabi nilang
proportion of the UK,
lockdown, yun,
78% of the population
pwede lang
are, as
mag-exercise
of
kapag
tomorrow,
pagka
being placed
lalabas
into
ka,
tier 4,
exercise o kaya
with
may
a
trabaho
small
ka,
minority
ganun.
remaining in tier 3 and almost nowhere now left in tier 2 and tier 1. So you can see, unfortunately, it is
Ayan
a
po, tier 4 stay
pretty
home.
grim
Tier
and
3 very
depressing
high.
picture at the moment. The situation in
Kung
the
nakikita
UK
nyo po, ayan po,
is
may mga
precarious
nakaano, ayan
in
o.
many parts already,
Ayan po,
particularly
ayan.
the southeast and London. And
Stay at home,
it is
tier
almost certainly
4.
true that the NHS has not yet
Dito may mga
seen the
nagrarally
impact
pa.
of the infections
Saan
that
po
will
kayo
have
ate? Sa
occurred
Canada po ba
during
kayo te?
mixing on Christmas Day.
Anong bansa po
And
kayo
that,
te?
unfortunately, is also rather sobering. So given that picture, I just want to say, look, I know New Year is coming up. I know it's normally a time
Canada,
of great
yes.
festivity
Canada po.
and enjoyment. But you have
Napakadami
just
nga po niya.
got
Malamig
to
din po
play
diyan, te.
your
Nag-i-snow na
part
rin po
now
siguro diyan. Dito hindi
in
pa po nag-i-snow
bringing
eh.
us back from this
Baka po
very
mga
dangerous
February pa ang
situation
snow.
that we find ourselves in. I will stop there, Prime Minister, on the
Thanks very much, Jonathan. That's very helpful. Steve, anything you want to add from the perspective of the NHS?
Yes, thank you, Prime Minister.
Tingnan niyo po
And
yung
as the
aming
Prime
Prime
Minister has
Minister,
said,
oh.
and as JVT has shown
Makapal
you in the
may snow
slides,
dito. Oh. Dito
high
din po,
infection
pagka
rates from
nag-snow
COVID
po dito,
are
makapal din
causing
po.
significant pressure on the NHS. And that is particularly the case in those parts of the country where the new variant has risen, and that's led to a rapid rise in infection rates, and again, as JVT has shown you, unfortunately, a high number of hospital admissions, and that's particularly London, the southeast, and the east of England. So I'd like to start tonight by paying a huge tribute
Yan po,
to all our
pinakamataas daw po
NHS
dito sa
staff throughout
UK,
the
sa
country.
London.
They have worked
Hello, good
incredibly
evening, Ate
hard over this
Elizabeth.
year managing patients from this pandemic.
Thank you,
And
Ate.
over the festive period, they have had to work even harder, particularly, as I've said, in those
Opo, may
areas
kapatid
which
na
are
nga po si
seeing those
COVID.
high infection rates with the new variant. They have absolutely gone the extra mile. In fact, they have gone many, many extra miles over the course of the year. And as JVC again has said, it will continue to be tough over the next few weeks.
Ayan nga po.
But of course, everybody is able to help the NHS and to assist our incredible staff
Sa
and play
dami
their
po.
own
Dami
parts.
po kasing
As
cases
both
dito,
the Prime Minister
doble-doble daw po
and
yung ano
Jonathan has
ngayon.
said,
Punong-puno yung...
we know it's the end of the year. It's a time where people traditionally want to celebrate, but it's absolutely vital that this year everybody continues to follow the guidance by staying at home and not mixing. My colleagues, as I've said, up and down the country, continue to work hard
Ayan po, stay
with
at
record
home
numbers
daw.
of patients with COVID, and of course,
Pero
keeping
nakakaboring sa
vital
bahay,
services
para ka
such
din
as cancer
nakakulong kasi
treatment
dito.
and accident emergency departments open at the same time for people who don't have COVID.
Lalabas lang
So
po
we can
kami
all
pag
play our parts in
magsha-shopping
fighting
kami
this
ng
terrible
food
virus.
namin. Yun.
Stay at home, mark the new year with just
Stay
nearest
at
and
home,
dearest within
guys.
the rules. This action will reduce infections,
Buti
relieve
pa dun
pressures
sa
on
Pilipinas,
hospitals,
sa aming
and that's how
province, walang
everybody can help
cases
to
na
save a life.
ganito.
COVID loves the crowd,
Parang
so
gusto ko nang
please
umuwi.
leave the parties for
Kaso,
later in the year.
hindi pa pwedeng
Thank you very, very
mag-ano.
much, Steve. And I'm sure everybody will echo
Hindi kami pa
what
pwedeng
you've just
umuwi
said about
agad-agad.
our
Lockdown
wonderful
naman kayo
NHS,
hanggang New
the
Year.
care workers, everybody
Opo.
keeping people safe this winter. Let's go to questions from the public and sorry, yes, of course, JBT. Would you say something about the vaccine? Thank you.
Yes, so it's not all bad news from my corner of the room. It's actually also a very good news day with the authorisation of the Oxford AstraZeneca vaccine. And I want to really thank the scientists who've worked night and day for the last year getting this vaccine together, and also thank the doctors and nurses of the National Institute for Health Research, the NIHR, without whom this whole trials programme could not have come together in the way it has. So, we have MHRA conditions for the new vaccine, authorised, very
Kamusta
standard
po kayo, Ate
conditions,
Elizabeth, dyan?
quite what you'd
Sa,
expect for any
sa Dubai?
new vaccine. The JCVI has made an announcement
Marami din
that
po
the
bang cases
vaccine should
dyan
be
sa
pressed into
Dubai?
service immediately alongside the Pfizer vaccine. The JCVI's view is that these are two good vaccines with no major distinctions between them. Now, I want to caution everybody, particularly the media, about over forensic examination of percentage vaccine effectiveness. It's really important to remember that the definition of illness in the Pfizer and the AstraZeneca programs were different, so they were
Buti sa
slightly
inyo, te.
different
Dito ang
endpoints,
dami.
so you
Grabe.
can't really compare them.
Kaya
But what really matters to us is not an endpoint that measures illness, but how these vaccines are going to impact on severe disease, on hospitalizations, and on deaths. And I'm confident, and I think the JCVI are also very confident, that both of these vaccines will do that. There is already some preliminary data from the AstraZeneca program. There have been just 2 hospitalizations in the the whole of the clinical trials programme in patients who received the vaccine. One hospitalisation occurred 2 days after the vaccine was given, so you can easily work out that the infection occurred before the vaccine was actually administered. And the second one occurred 10 days after the vaccine was given, and again,
Nako, lobat na ako.
was given. And again, 10 days is not long enough for a vaccine to work. Optimistically, you'd say 7 to 10 days you might get some effect, but far more typically, it's 14 to 21 days where and this is very, very encouraging, albeit preliminary data. The other really big thing that JCVI has changed for us in the last 24 hours is this very clear advice to prioritise the first dose to as many people as possible. This makes enormous sense to me as somebody who's public health trained, and I'll try and explain.
Okay lang naman, wala pa naman nababalita. Buti sa inyo, te, okay kayo. Dito sa amin, hindi. Grabe dito. Sobrang kapal ng ano.
Secondly, the MHRA has given the operational flexibility around the interval between the doses, so that operationally there is room for manoeuvre now. The second dose of both vaccines is integral. It remains important for longer term protection, but the priority is the first dose. And so what does that mean in terms of, how's this strategy been put together? I want to try and help people understand that. And basically, you take what you've got, you work out what you're going to get, you look at the epidemiological situation in front of you, and then the scientists and the modelers from the JCVI put all that together and they say, how do we get the maximum benefit for the most people in the shortest possible time? And that's the approach they've chosen. And this has been strongly endorsed by all 4 Chief Medical Officers of the United Kingdom. Thank you, Prime Minister.
Thanks very much, JBT. Let's go to questions from the public and from the media. First, Cameron in Buckinghamshire.
There are reports that Tier 4 restrictions may be in place until the spring. With so many businesses on their knees, what assurances can you give that this won't be the case and businesses can look to reopen in the new year?
Well, Karen, thanks very much. You heard about the measures were certainly having to put into place across many parts of the country, Tier 4 or Tier 3. We want to get those areas out as fast as we can, but the data at the moment simply doesn't allow it. The spread of the new variant simply doesn't give us the scope to do that. I think there will obviously come a point when we've made so much progress with the vaccine and also with tough tiering that there will be different options. We hope that comes as fast as possible. I think that
kay Boris.
We've heard previously from Chris Whitty and others that April the 5th, Easter, we really are confident that things will be very, very much better. And obviously we'll try and bring that date forward as fast as we can. And that's why the vaccine rollout programme is so important. And what JVT had to say just now about accelerating that rollout programme with using the first dose on as many people as possible is encouraging. But is anything either would like to add to that one? Ivy, thank you very much. Let's go to Jonathan from South London. And this is, Jonathan asks, given the high rates of COVID infections and hospital admissions, why has the government decided not to reopen the Nightingale hospitals? Well, actually, as far as I know, Jonathan, I can tell you, we are going to be making sure that the Nightingale hospitals are available. They are certainly available, but they're there not to be used immediately as long as the other provision is still there. But Steve, I know you've been working on this very closely.
Yes, thank you, Jonathan. So the Nightingale hospitals have obviously been there over the course of the year. They are our insurance policy, there as our last resort. And indeed, we asked all the Nightingale hospitals a few weeks ago to be ready to take patients if that was required. And indeed, some of them are already doing that in Manchester, taking step-down patients, in Exeter, managing COVID patients, and in other places, managing diagnostics, for instance, and diagnostic services. What we've learnt over the year is that we can use the Nightingales for a variety of purposes, as I've just explained. So we will be keeping those purposes under review. Our first steps, though, in managing the extra demands on the NHS are to expand capacity within existing hospitals. That's the best way to use our staff. And then, if needed, we can also put in place mutual aid between hospitals and healthcare organisations. That's exactly what's happening in London, the South East and East of England as we speak. But as the Prime Minister has said, it's critical that those Nightingale hospitals are there if they are needed.
Thanks, Steve. Let's go to the media. Fergus Walsh, BBC.
Prime Minister, how many people will the NHS immunise every week? Because surely it needs to be in the millions.
Well, thanks very much, Fergus. I think the